going to be a discussion on how to use the Puritan Bennett 760 ventilator. This is your screen. You have your patient data, your ventilatory settings, your alarms, and then your alarm silences and reset. On the back, we have our high pressure oxygen hose, our power cord, and this is our on and off switch. We're going to plug in oxygen, 12 o'clock, 6 o'clock, 12 o'clock, 6 o'clock. And we'll plug our power in. Now we're going to put the circuit on. This is your inspiratory. This will be your expiratory. Inspiratory filter. Expiratory filter. Small side up. We have our water chamber. We're going to connect our inspiratory filter to the water chamber. The ventilator circuit with the temperature sensors to the water chamber. The expiratory limb to the water collection. And then to the expiratory filter. This is the heated circuit setup, non-disposable. To connect your heater probes, you're going to connect in your temperature probe. Short end goes here with the V to the V. And then this goes to the patient. Now we'll turn the ventilator on. Flip it up. And now we will perform the short self-test. We go to menu. We scroll down to self-test. Make sure that the circuit is open. Accept to proceed. We turn the knob to go back to the short est. Accept to proceed. You can wait the 10 minutes for the ventilator to warm up, or you can clear to bypass. We will clear to bypass. Is the patient disconnected? Patient is disconnected. We will hit accept. Now we block the Y. Hit accept. We're going to choose dual heated wire. It's adult tubing. We can change the ET tube size and accept. Now we're going to test the filters. We'll hit accept. We're going to disconnect the inspiratory. Hit accept. We're going to reconnect. Hit accept. We're going to unblock the Y. Accept. We're going to block the Y. Accept. Disconnect the expiratory filter. Accept. Reconnect the expiratory tubing. Accept. We hear the alarm, so we accept. We hear the alarm, so we accept. We hear no alarm, we accept. We hear the backup alarm, we accept. And we are done with our self-test. To start ventilation, we need to accept our settings. These are the proposed settings. Volume control, assist control. Rate of 14. Tidal volume of 500. To accept, we accept. Accept, accept. You must accept all the flashing numbers. We are on a PEEP of 5, 21%, and we accept. Our settings are accepted. We're now ventilating. Here, your alarm silence for 2 minutes. To reset the alarm, right underneath. What the patient is doing, we have a peak pressure of 32, mean airway, plateau pressure when you push the inspiratory pressure, PEEP, rate, IE ratio, inspiratory time, exhaled volume, tidal volume, spontaneous volume, and you're delivered. High rate, these are now your alarm settings. High rate, high tidal volume, low inspiratory pressure, low tidal volume, high pressure, low exhaled minute ventilation. To change, you would highlight, and accept. Your apnea parameters are here. If we highlight apnea parameters, these are your proposed apnea parameter settings. You must either accept a flashing or you may change and accept and accept. To accept that, we hit accept. To change from volume control to pressure control, we hit pressure control. These are your proposed settings. You may either accept or change and accept. PEEP of 5 remains the same unless you change it. FiO2 remains the same unless you change it. Now you accept. To switch to pressure control SIMV, we can do SIMV, proposed settings, you must accept or change. The PEEP will remain the same and the FiO2 remain the same unless you change. Your pressure support above PEEP. To accept, we accept. We are now in SIMV pressure control with a pressure support of 10. To change to spontaneous mode, spontaneous mode. These are your proposed settings. You must accept or you change. PEEP remains the same. FiO2 remains the same unless you change it. You accept. These are your proposed apnea settings. Should you stop breathing in your pressure support mode, you must accept and accept. We are now in spontaneous mode. To change back to volume, we will hit assist control, volume control. These are your proposed settings. You may accept or change. FiO2, PEEP remain the same unless you change, and then you accept. To do a plateau, highlight your plateau pressure, choose your inspiratory pause, and there's your plateau. To suction the patient, you will press the 2-minute alarm silence and your 100% oxygen and suction your patient. And then we'll just turn the ventilator off when the patient no longer requires the ventilator.